Hello everyone, today is day 19 of discussing important perio tables from Dental Pulse. Let us look at this slide on smoking and periodontal prognosis. Smoking is one of the most important modifiable risk factors affecting periodontal disease progression, treatment response, and long-term prognosis. Effect of smoking on periodontal therapy. First, we will discuss how smoking affects different phases of periodontal therapy. First is effect on non-surgical therapy. Non-surgical therapy mainly includes scaling and root planing. In smokers, the clinical response to scaling and root planing is reduced. So, we observe less reduction in probing pocket depth and less gain in clinical attachment compared to non-smokers. An important point to remember is that even when smokers maintain good plaque control, their response to therapy remains inferior. This is because smoking causes vasoconstriction, reduced blood supply, altered neutrophil function, and impaired fibroblast activity, which together delay periodontal healing. Now, effect on surgical therapy and implants. Now, coming to surgical therapy and implants, after periodontal surgery, smokers show less pocket depth reduction and reduced clinical attachment gain. In furcation involved teeth, smoking may lead to deterioration of furcation status after surgery. When regenerative procedures are performed, such as guided tissue regeneration, bone fill is significantly reduced in smokers. Additionally, smokers tend to show increased gingival recession, which can compromise both aesthetics and root coverage outcomes. In implant therapy, smoking is a well-established risk factor for implant failure and peri-implant bone loss. Next is effect during maintenance phase. Even during the maintenance phase, smoking continues to have a negative effect. Smokers often show increasing pocket depths over time despite regular supportive periodontal therapy. This indicates that smoking affects not only treatment outcomes but also long-term stability. Now, factors determining periodontal prognosis. So, let us look at the second part of the slide. These factors are best remembered using the mnemonics SLPA or PALS PALS. First, we'll talk about systemic factors. These influence the host response and healing capacity. These include smoking, which is the most significant modifiable risk factor, genetic factor, systemic diseases, especially diabetes mellitus. L stands for local factors. These favor plaque accumulation and disease progression. These include plaque and calculus, subgingival or over-contoured restorations. P will stand for prosthetic and restorative factors. These include caries, abutment teeth, non-vital teeth, root resorption. Poorly designed restorations that increase plaque retention. A is anatomic factors. Anatomic factors make plaque control difficult and reduce periodontal support. These include short tapered roots, cervical enamel projections, root concavities, and root proximity. So, a quick memory tip. Smoking causes 3 Ds: reduce pocket depth reduction, reduce attachment gain, and reduce bone fill. And prognosis factors can be remembered as SLPA. Thank you.